Hi, my name is Michael Mitchell. I'm the Chief Executive Officer for Crisis and Counseling here in Augusta, Maine. And I want to talk a little bit about the obvious concern that we've had in our state, and we've heard in the media about the heroin epidemic that's really devastating our community, and it's statewide and nationally. Many other states are struggling with the same thing. But I want to generically talk much more about substance abuse in general. That what we know is that substance abuse, alcohol, and other drugs, as well as opiates, have taken a considerable cost in our national way of life. The estimates are well over $500 to $600 billion a year for the economic impact that substance abuse has on lost productivity, on treatment, on law enforcement, and other related costs that we have to pay for in the end run for substance abuse in our communities. In the face of that, we also know from significant research over the last 50 years that substance abuse treatment, if a person is invested long enough and is able to get the resources and access to the treatment in a timely manner, is effective. It can turn it around. It can change lives. But that means it also has to match the level of intensity of that addiction and include things like 12-step programs and peer recovery support so that people who have been there and done that can join in the recovery to create a new identity that is clean and sober and to create a culture that supports that person continuing to live that life. But what we also know is that it really requires the entire community to invest. If we say it's about those people, if we say it's about people who are not part of our lives, we are not really being realistic. And we also are not going to step up and invest in what's really necessary to turn this around and keep it there. So I ask you to join us in trying to find ways in which to meaningfully make a difference and minimize the negative outcomes of substance abuse in our communities. Thank you.